Imagine being afraid to exercise, sneeze, cough, or even laugh. For women with stress incontinence, avoiding all of these, at least in public, can be consuming. Stress urinary incontinence, or SUI, is a weakening of the muscles that control the bladder. When pressure is applied to the abdomen, like during a cough, women can experience accidental leakage. It's an embarrassing condition that many women don't want to talk about, even with their doctor. Kathleen Kursick knows all too well how SUI can affect every part of a woman's life.
Having stress incontinence really impacted my life. It caused me to not want to do certain activities. It caused me to have to plan ahead for every activity I wanted to do, but it really stopped me from doing activities like walking with my husband. Stress incontinence can be embarrassing because you are constantly worried about it, and you're constantly having to interrupt activities when you're out with friends because you're having an issue. So it can be embarrassing because you don't want to share what's going on, and people wonder, but you don't want to tell them.
Fewer than just 15 years ago, the most effective treatment for incontinence was a major surgical procedure. But today, there are many more options available that women might not know about. These treatments include antidepressant medications, exercises to strengthen the muscles, removable devices that can be worn during exercise, radiofrequency to firm tissues and reduce leakage, and the sling, a 15-minute outpatient procedure with an 85% success rate. The sling is today's most common solution for SUI.
Women with stress incontinence have the problem because of some combination of weak muscles and weak ligaments. Now, only exercise can help make the muscles stronger, but surgery replaces the ligaments. If you imagine that this catheter I'm holding represents the urethra, or the tube that brings urine out of the body, and there should be a ligament right in the middle of it, and I'm going to use this little piece of synthetic to act as a ligament. When it's loose or torn, if a woman coughs, the urethra moves too much and urine gets out from the bladder with each cough or step that she takes. What the sling does is, through a tiny vaginal incision, puts the new ligament in place, and it has a backboard for the urethra. When she coughs or sneezes, there's a little kinking effect so that urine can't get through. And that's how our body's designed. That's how our own ligament should be working.
Because these are minimally invasive procedures, most women, even if they have medical conditions, can undergo the operations without any difficulty. They're outpatient procedures. The technical component really only takes about 20 minutes, and they can be done even under local anesthetic. So patients who might have anesthesia issues can still have the slings performed. The recovery time after a sling procedure is usually about 2 weeks, that we tell patients to be careful with strenuous or stressful types of activities. But patients are eating regular food the same day as surgery. They go home the same day. They can walk, go up and down stairs. Most patients are able to drive within 24 to 48 hours. Many patients only take over-the-counter pain medications, so the recovery is actually fairly easy.
If you're suffering with stress urinary incontinence, talk it over with your doctor. She'll help you explore all of your options and find relief.
My advice for women with stress incontinence is, first of all, speak up and then get help. If you've been told that it's just part of aging and there's nothing that can be done, don't settle for that. If you've been sent to for therapy and you're not getting the response that you want or the results that you think you should have, then look elsewhere, because there is help available and it doesn't have to be surgery. But on the other hand, don't be too afraid of surgery. We see women all the time who are afraid because their mom or their grandma had surgery 10, 20, 30 years ago and did not get a good result. Well, surgery is totally different these days. And with the midurethral sling that can be performed in 20 minutes under local anesthetic with great results, women shouldn't necessarily think that they need to be in diapers before they can have the problem fixed.
The treatment I had for my stress incontinence was the sling, and it has changed my life. It worked perfectly. Stress incontinence is no longer a factor in my life. I feel it's important to talk about the issue of stress incontinence because if it helps one other woman get the treatment she needs, then it's worth any embarrassment I might feel by going on camera with my story. For other women who have stress incontinence, I would say don't hesitate to talk to your doctor about it. Don't wait 2 or 3 years like I did. Get into the doctor's office and get treatment, because there is treatment available and it will change your life.
With 11 locations in the Chicago area, the team at Illinois Urogynecology Limited specializes in helping women overcome stress urinary incontinence. By age 40, more than 25% of women have some degree of SUI, yet many suffer in silence. Illinois Urogynecology Limited works to educate women about this condition and offer them a variety of safe, non- or minimally invasive treatments.
Our mission is to provide excellent care to women with incontinence. We want women to know that they're going to get the best evaluation to make sure we know what type of incontinence they're dealing with, and to make sure they're educated about their treatment options so they know what's best for them, whether it's medication or other non-surgical therapy, such as physical therapy. And if they decide to have surgery, to know that they are getting the best surgical care possible, that their procedure will be safe, and that they should get a good result.
Since 2003, the physicians at Illinois Urogynecology have given exemplary, compassionate care to women with incontinence, pelvic organ prolapse, and pelvic floor dysfunction. This experienced team of surgeons performs more surgeries for stress incontinence and pelvic organ prolapse than any other practice in the Midwest. But these physicians are thoughtful in evaluating each patient individually and explore non-invasive treatments as well as surgical ones.
The most important factors when we evaluate patients are, number one, to help them understand that this is a quality of life issue. So each patient is going to have their treatment individualized based on their own issues in terms of how much the incontinence is interfering with their daily activities. And the second factor is to make sure that we provide them with enough education so they really do understand what the different options are, and they can choose the right treatment for themselves in the context of how their incontinence is affecting their quality of life.
Illinois Urogynecology has helped thousands of women overcome stress urinary incontinence and reclaim their active lives.
The treatment option that worked best for me was the physical therapy. I started with the physical therapist. I went once a week for 3 months. She gave me an exercise program and exercises that I need to follow up with at home, and I noticed results probably after a month and a half, 2 months. I would recommend Illinois Urogynecology because it's such a specialized area. It's more than just a urologist can address or more than just a gynecologist could address. They can give you all the options from the very conservative as far as therapy to the much more advanced as the surgical options.
I would recommend Illinois Urogynecology to any woman with this problem because they treated me with compassion and minimized the embarrassment that I felt when I first came in, and explained everything and gave me all of the options that were available and allowed me to make my choice. And I've been extremely pleased with the results.
The future of Illinois Urogynecology is for our physicians and other providers to keep learning. We will stay on top of the research so we know we're delivering the very best care that's available. One of our other goals is to consider continuing to expand. As women continue to call us from communities that are geographically not convenient to our current locations, we'll look at adding other offices. And another primary goal for us is to keep teaching. We want to keep training the medical students, the residents, the fellows, and the nurses so that we have more people to provide the care that's the quality women deserve.
If you suffer with stress urinary incontinence or other pelvic disorders, contact Illinois Urogynecology today. For more information, visit www.iultd.org.